Are you experiencing pelvic pain after you gave birth and you feel one side of your hip is not the same again since you have your baby? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. If you're suffering from pelvic pain, groin pain, and you have difficulty squatting, you need to target the deeper muscle structures of our hip joint. I have a lot of patients with difficulty squatting, doing higher impact activities due to a pain on the hip joint, and they can't do their strength training workout. So this video is for you. If you're suffering for many years, it could be recently, if you're cleared for exercise, if you're postpartum and you had your baby 6 weeks ago only, don't do any strength training like this too much. I recommend you to see a pelvic floor therapist, making sure you strengthen your pelvic floor safely and effectively first, and then you can proceed with this program. This is a little bit more advanced, but still safe for you if you're cleared by your doctor once you're ready on your at least 2 to 4 months postpartum. But with proper breath work, that's why I recommend you go back to my beginner program. Learn proper breathing first. If you don't know how to breathe, you're hurting your pelvic floor if you're straining. And I recommend, if you want to strengthen your abdominal muscles and your core, the number one rule is don't do ab crunches or sit-ups. Those exercises put downward pressure on your pelvic floor. So I recommend do some core exercises with support first if you're just postpartum or you're suffering from pain. If you're doing squats and you're having a lot of pain, stop. You won't strengthen your hips. You won't strengthen your lower body. It's best to strengthen it deep inside your core first, then slowly progress with your squat when there's no more pain. So let's begin the program right now. We're going to use a soft foam roller. If you need a soft foam roller, check out my link on the description below. And I have my own foam roller that you can use effectively. It's very soft, it's very gentle if you're having pelvic pain. So let's begin the program now. If you need a foam roller, I best recommend my foam roller. Check out the description below. And you can access my very soft foam roller, great for absolute beginners. So you're going to place the foam roller underneath your pelvis. And before you proceed to any strengthening exercise, it's best to engage your core muscles first with proper breath work. So as you breathe in, most of my pelvic floor patients or back pain patients, they hold their breath. You want to make sure you breathe in through your nose, expand your abdominal muscles. That helps relax the pelvic floor and gently stretch it safely. So I'm bulging my abdominal muscles. I'm gently stretching it. As I breathe out, I'm slowly lifting it up. Kegels together with Kegels, which is imagining not to poop. I like the back end of our pelvic floor. And gentle to the abdominal muscles. You don't want to pull it too hard, not as hard as you can. You want to make sure gentle lift. Pelvic floor muscles, you need to make sure it's gentle. It's almost like a blink of an eye. You don't want to be aggressive. Squeeze imagine not to poop or not to fart. That's enough to engage the back end and gently lift the front part and exhale. Breathe in, expand. Exhale, lift. Don't pull it as hard as you can. You don't want to suck it in. When you suck it in, you're using the superficial structures of the abdominal muscles, the rectus abdominis. We want to focus on your transverse abdominis. Almost you want to brace this area, the lower abs. Inhale, exhale. Okay, with the dumbbells, if you're absolute beginners, you don't need to use the dumbbells. You can just keep your hands pointing up as you breathe in. Breathe out, slightly lower extend your leg. Exhale, gently stretch this area where you have pain. Slowly strengthen your hip flexors. Slowly slide left and right. The purpose of the dumbbells is will help engage your core muscles. Even lifting your hands pointing to the ceiling is enough to challenge your core. If you just gave birth 2 months ago or 4 months ago, you want to be slow and steady, especially if you have a cut like episiotomy or a tear from giving birth. I'm slowly squeezing as I extend and expand my abdominal muscles as I bend. Exhale, protecting my core, alternating left and right. Well done. Now, after doing that, we want to strengthen your hip flexors. That's where you might be pulling your muscles after giving birth. So inhale, exhale, lift to a tabletop with your knee bent. Breathe out. Inhale down. Exhale, switch to the other side. Breathe in, slow and steady. If you notice, I'm not plopping my foot
I'm alternating left and right with each of my breath. Inhale through your nose as you step down. Exhale as you switch and lift. 4 more. Feels good on your hips. Breathe in. Breathe out. 3 more. Two more. You might feel heavy if you can't lift your knee up yet. Just slowly, left and right, just glide your foot down the mat. Last set. And last one on your left. Well done. Now, after doing that with your feet down, we're going to slowly open your knee out. Gentle hip opening, keeping the other knee pointing to the ceiling so you're not rotating your spine. I'm lowering one dumbbell down to the side as I breathe out. Inhale, back center. Pushing my belly out to stretch my pelvic floor. Exhale, zipping it up, including the Kegels, which is imagine not to poop or fart. Slowly squeeze your abdominal muscles, not too hard. So slowly stretching without pain. Just a gentle stretch, alternating left and right again. Breathe in, breathe out. Feels so good to stretch gently. If there's a lot of pain, you're not ready yet to open your knee out as much. You can just slowly open it slightly prior to pain. If you're going all the way down and if you have pain as you open your hip, I would rather you open halfway through before pain. You just want to slowly stretch those areas, especially if you had a cut in or episiotomy and you feel like your baby pulled those areas. Last set. Well done. The next exercise is butterfly stretch. So you're going to slowly open your knees out and your hands out as much as you can. You feel a deep stretch on your pelvic floor and your groin muscles. Inhale. I'm expanding my abdominal muscles. You can see. Exhale, back center. And once you reach the center, you squeeze your knees together to contract your hip adductors to protect and strengthen. Breathe in and then breathe out again as you open. And once you reach the stretch position, you take a deep breath again. And then exhale again as you go back center. And squeeze your dumbbells together and your knees tight to do isometrics and gentle hold as you breathe out. And then inhale again. You can see I'm expanding my abdominal muscles. And then exhale, open, squeezing, Kegels all at the same time, imagining not to poop or fart. Gentle squeezing your abdominal muscles. Breathe in. Breathe out, back center. Squeezing my hands together with the dumbbells and my knees tight. Inhale. Exhale, open. Inhale. And exhale, back center. Well done. So after doing that, let's target your hip abductors. They're very important to strengthen if you're having pelvic pain. So you lie on your side. Knees bent to 90 degrees. We're going to do a gentle clamshell. Opening your knee, the top knee, keeping your foot together for 5 seconds. If you start rotating back, you're going to hurt your back. You want to slightly lean forward. And you don't have to lift as high as you can. You can just halfway. As much as you can, if you can control, especially if you're tight. Hold it for 5 seconds, hold, and then down. Making sure you're including your breath as you lift. Hold it for 5, 4, 3, 2, and 1. Inhale down and exhale up. 5, 4, 3, 2, 1. And my recommendation is to do it 10 times. Each hip. Well done. So we just did 5 times just to demonstrate today. If you want to follow along video, let me know. Leave a comment down below. Take a deep breath now and we're going to do hip abduction. You can bend the lower part of your leg for stability and lift the leg as high as you can. If you can't lift as high as I can, like this, just lift it like this, a few inches off, especially for absolute beginners, because you're going to feel the burn because you're going to hold it for 5 seconds. Just for stability. Inhale, exhale. It's not about as high as you can because you might hurt yourself. Even with this level, it's enough to feel the burn. If you hold, especially 5 seconds, hold, even without resistance. especially if you're having a lot of pelvic pain. So you might compare the good side from the bad side and do that 5 seconds hold 10 times as well. Let's switch to the other side so you can compare how the pain area, where you have pain usually in one side, if it's both sides, then they're going to be the same. Let's do clamshell, knees bent to 90, and lift for 5 seconds hold. With your breath, you want to make sure you gently squeeze your pelvic floor by imagining not to poop. You're going to feel the gentle lift, not too hard. Inhale as you go down, exhale as you lift. 5 seconds hold. And the gentle progression with your leg extended, arms overhead. Bend the lower leg and lift as high as you can without pain. And for beginners, just a few inches off the floor. 5 seconds hold, you're going to feel the burn. You might feel shaky now, and you might find one side stronger than the other. And that's when you're going to do an extra set on the weaker side. Last one, inhale and exhale. And that's it. I'm hoping you learned a lot on how to strengthen your hip muscles safely and effectively for suffering from pelvic pain, hip joint pain, to strengthen the stability of your pelvis. If you love this video and want to learn more about Pilates, yoga, and physical therapy, please subscribe to my channel, ring the bell so you won't miss anything. Like and share this video. Every like you're giving to my channel, you're supporting me. And if you need my help and guidance, I have my Revive Pelvic Floor Health Core. We have one-on-one coaching coming up soon. If you need to be guided safely and effectively, if you're having pelvic pain postpartum, and if you're having excruciating back pain, I have a back masterclass, one-on-one coaching as well. Check out the link down below to help you guide you with my weekly Zoom calls. Until my next video training, if you have more time today, check out this video about SI joint dysfunction and this video about obturator and Hernias. Until next time, always remember, be safe, be well, and healthy.